Hi everyone, welcome. I think everybody these days is familiar with using Zoom, so I don't think I need to give you instructions, but I am happy to have it interactive. So first, I'd love to hear where people are joining us from. So pop into the chat for me so I know where you are. I'm in Melbourne, Australia here. Actually in the clinic today. So we're going to use a couple of the dogs in the clinic and showcase a few bits and pieces. So I know we've got people on different time zones then, some from Australia, New Zealand, USA. Beautiful. It's really wonderful for me to be able to connect with people all over the world. And I'm really excited to be able to do this. So I've invited you to come to this webinar to learn how to assess, or how I assess, the Canine Health and Wellbeing Academy way. So it's techniques that I've put together over my 20 plus years of experience. And it's the way I teach, particularly in the Canine Health and Wellbeing Academy. So thank you to the people that have shared their dogs. We're going to use some of those today. I'm not going to be able to use all the cases. I've got 3 to showcase. And if you've got your dog, you'll be able to join along in some of the massage techniques that we were going to do. And I haven't offered this before. I typically only offer it once you're inside the training programs. So why am I offering it now? You will all be aware that we're open for enrollment in our certificate programs, but you already know that because you're in our list. So you've either already done one of my programs, you're interested in one of the programs, so you might be in our mailing list, or you might have already enrolled for this intake that's coming up and you're waiting to get started. So it doesn't matter, who you are. I'm hoping to share something that of value to your dogs, to be able to connect with you, for you to get to know me better, and for you to have the opportunity to learn something that's going to help your dog. So I'll share a little bit about me. I'm not going to do, a big backstory, but if you have not met me before, really at this stage in my career, I get to share, this is my life's work. So I'm very fortunate. I am on my path. I am completing my soul's mission, which is to help as many dogs and the people who care for them as possible while I'm on this earth. So I get to do that in the clinic here, but also one of the other ways I get to do it is to connect with people in the certificate programs and teach all my knowledge and skills to you, so more people can go out and we can, help more dogs globally. You'll hear I talk a lot. I get on a roll about talking about dogs and healthcare and the owners that are attached to them, because I am super passionate about this, and I think it's vitally important. And we make, amazing connections every day in the clinic here, and then in the people that come and work with us. And I think in all the chaos that we have that can consume us on a day-to-day basis, everybody has such busy lives now. It's great for me to come into the clinic and always then come back into my heart and be in a place of service and do something that really lights me up, calms me down, and also, helps me to have other people be able to come into that state. So we do that with our owners in the clinic, and we get to do that with our academy graduates that get to go out and then also continue on those amazing transformations. So I want you to be able to feel like this too, helping dogs, having a successful business or career if you chose to do that. But if not, then just adding some value to the management of your own dog and helping your dog to have a life of, vitality and longevity, with great mobility. So we are in our clinic today. I'm just in a consult room here. So you might see, we've just checked any owners that come into the consult room behind me, they know they're going to be filmed. So you might see a few people. But this is, easy for us to be able to showcase and just have dogs that are coming in and out. So there might be a few bits and pieces that are going on in the clinic, but that's the real life. So I am going to do a few slides just so that you can follow through the assessment principles that I teach. I'm going to talk about the cases that some people have shared. So you can definitely ask questions as we go along in the chat, and the team will answer them, but then I'll come back to the screen when I'm not doing some demonstration, and I can answer any questions for you as well. And we have another one of our team members here. So Claudia is a team member in Dogs in Motion in my clinic in Melbourne here, as well as at the academy. And she's got her dogs here that are both clients or patients of ours, and we have a lot of team members at Dogs in Motion that have first come as clients, and then they're just inspired by what we do and the difference we make to their dogs. A lot of them actually that then have gone on and done the certificate programs, and now, you know, they get to join our community. And, you know, the same for Tegan and Tanya, people that are in the team at the academy are because they're inspired by what we do, and they're, you know, wanting to have that path of service as well. So we're going to talk about the assessments, then we'll talk about some treatments. We'll go through, I'm going to demonstrate some massage on the dogs that's going to be specific for the cases, but then you can ask questions about your own dogs. And depending on how much time we have, I'm happy to put up other cases. It's just, I use the prepared ones so you can see on the slide. So if someone wants to, you know, show their dog in front of the camera, just, I'm happy to do that as long as you know, everyone can see it to get the benefit of that. And we'll just talk about some different treatments. Obviously, I teach hydrotherapy and massage. So we'll talk about, we're not going to go through hydrotherapy today because you can't do that for your own dogs at home, but, you know, the principles of it certainly. And again, why now? I think because I've been in the industry for 20 plus years, I've been able to see, you know, in the last probably 3 to 5 years, more than ever, people are now looking for things outside just mainstream veterinary medicine and surgery. And not that that isn't doing a great job. Absolutely it is. We need the combination of all those things. We are a team with the vet. We need the vet to be doing their diagnostics and the surgical and medical management. So I teach, and we're in our clinic an integrative clinic, which means that all those things need to be combined. So complementary, when we don't call ourselves alternative treatments, complementary, that are complementary to what the vet is doing. And integrative, we take the benefits of all the different things that are there and combine those together. And people are looking for these more than ever. So they're looking for massage, they're looking for hydrotherapy, and, you know, they're treating two quite separate issues. And for almost every dog, it would be great if they could have both. Not always the case, and a lot of our graduates do one and then, you know, talk about the benefits, get the benefit in their mind of the, and go and do the other course as well. Or people are looking for rehab, like myself as a physiotherapist. I've been here for many years, but the business part or the demand is definitely there. So for people that are thinking about it as a career, that is important for you. So we all want to help dogs and would love to spend all day long working with dogs. But if we're choosing it as a career, then we need our books to be full. We need our clients to be happy. We need our dogs to be having amazing transformations, so that that continues to be an easy business, if you like, that it just supports itself because of what we're able to provide. And that's what we have in our clinic here. So, and at the end, we'll open up for Q&A. And of course, we'll talk about if you're wanting to work with us and join the academy. And if you're not wanting to do that, you take away something that you might inspire you to, you know, inspire someone else that might want to do it, or inspire you to think about how you could provide better care to the canines that are around you. So I'm going to go in and share my screen. So bear with me while I just move a couple of things down. I'm going to close down my chat so it's not in the way. So if you've got any questions, then my team, if you just let me know. This one. Okie doke. There we go. And I can still see faces across the side. I just move it. So we're talking about specifically assessment, and the assessment that I teach within the Canine Health and Wellbeing Academy. So it's the same whether you're a massage or hydrotherapist. We teach the same assessment, except for the massage therapists, they go on to do soft tissue assessment in preparation for massage. So what does it mean to deliver a great assessment or perform a great assessment? And, you know, the thing that the vets do not have that we have, or I teach you to make sure that you take the time to do, is it takes time to gather all the information that you need to perform a great assessment. So vets can often have 15 minutes in a consult, might be different, you know, if it's their own business, 15, maximum even 30, to take all the information that they need to do any diagnostics. They might need to do some quick tests, you know, put some something under a microscope, do a quick blood test, and then to be able to deliver a treatment and a plan. And that is really not enough time for what we're trying to do to get this overall picture of the dog. And we're also then within that time making sure that we've got a connection with the person. So that is one of the biggest things for us in clinic. And when I talk about, in clinic and, you're coming through as people from the Canine Health and Wellbeing Academy, it's all interrelated. So, you're looking to have a business or help your own dog. All of those things are the same. If it's your own dog, you need to take the time to gather all the information. If it's your family member's dog, you need to take the time to make that all fit together. And that's not just the interviewing of the client. It is the putting all the pieces together really is what we're doing. So, it's an hour to an hour and a half for an initial assessment, including a treatment for a new dog. And in that time, we develop a relationship with the owner or the client, and we also develop a relationship with the dog. So, unfortunately for the vets, often so time poor, then they have to go in and do quick diagnostics. And within that time, then, dog might be frightened. They might need to put it up on a stainless steel table, from an infection control point of view, dog is nervous on there. So all these different levels, and we teach you how to, set things up. And if it's your own dog, obviously it's easier for you anyway, but set up the environment that is more inviting for the dog. If I want to perform massage on a dog or have the dog come into hydrotherapy long term, I don't want to rush that relationship. We want to develop a rapport because it might be quite new experience for the dog. And then, the first part is if anyone's from human healthcare here or, veterinary, we would have SOAP notes. So we would have our subjective, which is the gathering the information, the objective, which is all the looking and moving and feeling, and we go on to our assessment and plan afterwards. So this initial part here, what we teach in a lot of depth in the academy is gathering the background information. So yes, we're getting the vet history, but we're not just reading everything on face value. Of course, we need the vet's diagnostics and assessment, acknowledging that sometimes the owners choose not to do diagnostics. So the vet is limited in, they can only do what they can do. And then there's quite an extensive interview process of the owner. So the owner's reporting to us their version. We ask it again. We don't just take a history that says left hind limb lameness for hip osteoarthritis. We ask the owner, what's been going on? How did this occur? How long has it been going on for? How has the behavior changed? And then we get quite extensive information about the exercise that they're doing currently, how that might have changed previously, the home environment and the setup. So we're trying to look for patterns. And for some of the dogs that are presented here, they're owned, partway through their life. So not since person's had them as a puppy. That information we take on into consideration as well. And why is that? It's just for pattern recognition. If the owner has only had the dog for a year versus since it's been 8 weeks old, they're going to have a different, set of information for us. And we're really looking at what is the reason that the owner came? So yes, the dog might have gone to the vet because it's limping on the left hind limb, but that's different to why the owner has come to us. So the owner wants to know, what's the problem with my dog? Can you fix it at the veterinary level? Of course, when they come to us, then we can look into function. So more extensive, the vet needs to help with the treatment of that, and we can help with the treatment of that when we know what's going on. But also, what's the next level? What does the owner need the dog to be able to do and want them to do on a day-to-day basis? So do they need to be able to go up the stairs to sleep on the owner's bed at night, which is that, connection piece? So these days, a lot of people are isolated and the dog is their family. More and more, loneliness is one of the biggest problems on the planet now, and people are having animals. So that bond then is sacred, and we're trying to work out what do we need to do to ensure we can maintain that bond with the owner as long as possible. So it's not just a left hind limb lameness then. We're looking at what does the owner really need and how can we help that? And I might only have, massage or hydro or animal physio, me personally, skills, have all those skills, but I can't take an x-ray. I can't administer a medication, but I can support the owner to send them back to the vet and to encourage them to continue on and do, those diagnostics. And that's that working with the vet in that team. So we're getting on the phone, speaking to the vets, all the things people don't necessarily want to do. They just like to do their little, massage within their clinic here. But we have to have those communication, and we're looking for the highest level of service we can possibly give to the animal. So this subjective part can take sometimes half an hour. And again, more and more, I have several clinicians here that have been with me for a long period of time. And, we're having these discussions about, we're actually ending up doing counselling of the owners for a larger part of the consult. And no, we're not trained counsellors, but we're talking about the support for the owner and what this dog means to them and how our treatment can help them. So, again, more and more, thinking about this, the vet's not going to have time to do that, nor is it really their job. So we teach massage and hydrotherapy, but we still need this owner support. So a big period of time, gather all the information. Then the dog is hanging out in your consult room while you're talking to the owner and hopefully relaxed, but could be stuck under the chair, scared. The end of that section, then I really encourage you to start to get a picture in your head of what you think the dog will look like. Now, yes, you've seen the dog walk into your clinic, so you might have greeted them outside, or you can see them in your consult room. They're sitting, they're standing, they're moving around. So you're already starting your next section, your objective, but now we're going to do that succinctly. And also you'll see in the cases coming up what I mean by this. We're thinking, if I use this same example of a dog with a left hind limb lameness and left hip osteoarthritis, I'm already thinking about what that dog's going to look like. How old is it? What breed is it? Has it had any other problems? Where is it standing and transferring its weight? Is it walking with a lameness? Has it got any functional assessments, like difficulty getting up from the floor? Because I took all that information from the owner in this initial part. So I'm not then just going to the objective part, the next part, and trying to work out, what am I seeing? We're using the history to guide the next part of the assessment. And this wasn't taught to me as an animal physiotherapist, at a master's level. Definitely not. This is, what I've developed to help students. So feedback from students, like, okay, they're still not getting that. How can I teach it, pardon me, in a different way? Things that I was just doing automatically, that came automatically to me, that I can now teach you to be able to do that. So you're grateful to all the students and graduates that have come before. It means that we can always keep, improving, and we continue to do that and change the way that we teach. So then we're going to stand the dog up. Ideally, we're going to take it outside. So if you live in a country where it's super hot, so we're going to have 42 degrees Celsius on Monday here. So if I was working in the clinic, because it's public holiday here, if I have that day, I'm not going to take the dogs outside for a gait assessment on that day, because the pavement is too hot. And for some of the different conditions for the dogs, that's not appropriate. Plenty of the clients will cancel on that day, on a day of weather like that as well. But at the other alternative, if we had, rain or snow, or you were working in the evening, or in time zones where there's, shorter daylight hours, then we need to have set up in our clinic a place where we're going to be able to stand them up on a non-slip surface and perform a gait assessment or a walking assessment. And first we do posture and conformation. So we're going to look at them standing and look at where do they distribute their weight. And you'll see in the pictures I have, rather than looking and going, oh, I don't know, we're using the history that told us the dog had a left hind limb lameness. I'm going to go and look and see, is it unloading its left hind limb? We start as simply as that, teach you some other bits and pieces about where I expect weight to be transferred with different pathologies. So there's shortcuts for you to be able to know that, but you're not trying to just work it out for yourself. You're using the history to guide it. And then unless they're really fluffy, you're looking to see how well muscled they are, difference between front and back, and symmetrical. So this is our looking. What can we see? Anything catch your eye? Anything that was not in the history that the owner reported that you're looking at going, that's interesting. I'm going to ask the owner some more questions about that. So it's really this pattern of, we take a great history, we go and look and see, and now, we're continuing. Does that match the history? So if the owner said the dog's been limping a little bit on the leg and the dog's non-weight bearing, or vice versa, the client is really worried because the dog can barely get up from lying, and then the dog is bouncing around the consult room and looks quite easy sit to stand. then that's not a match. We might have to ask some more, clarifying questions. And that might be to the owner, no, that's really bad. It's like, okay, great. So the owner's interpretation now I'm taking into consideration. So all of this is working towards, what am I going to do from a treatment point of view with this great assessment first. So then the how do they move? So both walking or gait assessment, rather than a lameness assessment, we're looking at a walking assessment and functional movement. So like the normal things the dogs need to do, sitting, lying down, getting up. And when we take them outside, because lots of dogs come here, then they'll often go to the toilet. So that's a great functional activity. So we might have asked in the history for a boy dog, if they had a hind limb issue, can they stand on one hind limb to pee? And then we might have to go back to the history. Did they ever do that? And for pooping, then we might say, depending on the pathology, does your dog poop all in the one position or do they walk along to poop? And then, is there a history to that? And why do we want to know that? Because we're looking for patterns of what might be difficult for a dog, but also when we treat them, we're looking to see, can we improve those things, those functional activities for the dog? So, owners that are being faced with euthanasia for a pet, are often when they can no longer mobilize or they can't get themselves up to go to the toilet. So then you're going to the toilet where they are. So this can be a really important functional goal for us. So we're looking to see what does that look like now. And we can also use it as a reassessment when we've finished our treatment to see whether it's changed. And sometimes you can get changes on the spot, particularly with body work, but in our old patients, in the magic water, we call it here, and the underwater treadmill, we can often see that straight away as well. So then everybody, massage therapists and hydrotherapists, go on to a superficial palpation. And this is just a little snippet taken out of the course portal. We use Kajabi to store all our course material in. So there's lots of videos in there, demonstration of me doing superficial palpation. The superficial palpation is, again, it's just trying to get all those pieces to fit together. So I'm going to go back to that left hind limb lameness because of hip osteoarthritis example. Then I teach you, we're expecting this particular pattern of muscle atrophy or muscle wastage, and I'm expecting the dog to have this and this based on the history. Now you go and palpate and see if that's what you found. So you don't have to work out, I can't tell if this dog's got muscle atrophy or not. That is not your job. We're not making a diagnosis. That is the vet's job. We're relying on the vet and communicating with the vet to give us the information that we need. And then we're going to confirm or deny that. It's like a science experiment. So we do a whole superficial palpation in a complete pattern. So we do every dog the same every single time. So that helps our pattern recognition. So then after 5 years of treating lots of Siberian Huskies, for instance, we've got one of those as a case. If you did sledding and there's lots of Huskies, you'll get to know the Huskies are all slightly different, of course, within a breed, but most of them have large hind limb musculature, for instance. So then we can have a pattern of, pardon me, small triceps, big hind limb musculature. Does that fit with the history? So we don't just write down, I found there were small tricep muscles. You have to be thinking. We teach you how to do that. Does that all fit together with the history? Why is that? So, as a scientist, we have a questioning mind. I teach you to do that. You're always questioning. Why is that? Is that all fitting together? And again, that wasn't taught to me. Probably as a human physio, but coming over into animal physio, it's completely different. And because the dogs can't talk, there's so much more interpretation, we need to try to determine in order to choose a good treatment. So does it all make sense and fit together? So again, rather than just taking it on face value, what we're seeing, we're trying to determine, do all those pieces match together? And we might have to ask the owner some extra questions or ask the vet, or if something that's just small and we're not sure of, we could continue to go on with our treatment. And same thing, communicating with the vet or the community. For us, we have a community of private Facebook group where graduates can communicate, the separate student ones, but graduates can communicate about different cases and get support there. So the next part in our emails to you talking about coming to the webinar, where one of the questions was working out, is my dog in pain? So a lot of owners want to know that, and we cannot say whether a dog is painful or not as a massage and a hydrotherapist. That is a vet's role. So we want to be careful with our language to the owner of saying your dog is in pain. When we do a soft tissue assessment from a massage therapist point of view, we can definitely palpate tenderness and tautness, tightness, knots, any of those languages we might use. But saying that a dog is in pain, we just have to be careful of the language to make sure the owner doesn't become distressed. And we are not operating outside of scope of practice. So that means that we're going over into sort of a vet's role. However, there are clear behaviors, and this is all over social media, so you could put this into a Google or into Instagram, and there would be someone's created a nice PDF for you that you could, or a reel that you could see. But we're looking to see what are some indicators that the dog is in pain. So at the other end, there are owners that are telling me my dog's not in pain, but the dog has difficulty getting up from rest and the dog is limping on one or more legs. And for the most part, the reason those dogs are limping or having difficulty getting up from rest, there's going to be a pain element. So that is not for me to be able to say to the owner, I think your dog is in pain. We just have to be careful of the language. So we talk to you about what we say to clients in terms of functionally your dog's having difficulty getting up from rest, but I'm going to get on the phone to the vet and say the dog's limping. It's got trouble getting up from rest. I'm going to send it back to you for a pain reassessment, and then they can do that at their level. Me as an animal physiotherapist, so one of my massage or hydrotherapists said they thought the dog was in discomfort, then it can come to me at that level for an assessment, and I can send it back to the vet. So trying to work out if any of your dogs are in pain, we'll look at the cases that we have today, and we can make an interpretation of whether we think what types of big things cause pain. So if we've got osteoarthritis in joints, if we've got, a disc bulge, we would suspect that there is pain. And then we look for patterns of movement. So if dogs are deteriorating in mobility, if they're choosing not to get up and move about so much, difficulty, jumping into the car or onto the furniture, and lameness or limping on a leg, or a leg not being used so well, then that would be signs of pain. So that, are they moving as they should? For plenty of owners, they can't interpret that. Now, if you're here and you're a dog-loving person, a lot of us are already switched on and really tuned in with our dogs, and anything like, is that something I need to be worried about? And sometimes we're overly concerned, me included, about particularly when you've been around dogs and dog problems for a long period of time. So thinking about your own dogs, when I move through the cases next, then you'll see what it is, really putting that history together of what they can do. So here's an example of a doggy patient of ours that the owner's really concerned that the dog is in a huge amount of pain, and she's worried that this is going to be the end of the dog. So the dog is having trouble getting up from rest, yet she walked to the clinic and it took them 2 hours. So there's a mismatch with that. So then when we look at to me, the dog has to be functional, and it's moving around in my consult room. It's got some slowness to rise, but it's really matching together what the owners said and what we're seeing to try and work out, are they moving as they should? So we're not doing a lameness assessment, trying to pick which leg is lame and any tiny asymmetry. We're using the history to work out, is that all matching together? And I'm going to go and do massage on this dog, so I'm more interested in what the soft tissues feel like, where the history tells me there's a problem. Can I see any compensation? Is the dog loading up in a place to compensate? And then I know those tissues are going to be tight, so I'm going to start my treatment there. And trying to work out what is normal. It's like humans, what's normal? There's lots of different variations, but we go to that extensive subjective history or questioning initially, and really working out how functional is this dog. So if it can do all its stuff, if it was a performance dog and it's got a tiny little bit of, like, maybe it's knocking a couple of bars, if it's a agility dog, so something slightly off but it's still very active, I might not be able to see anything out of the ordinary when that dog moves, because it's something subtle, but when I feel it's muscles, I might be able to feel a difference between left and right, or I might not. And then I'm going to use my principles of, well, I'm going to treat this dog's whole body then anyway and try and get resolution for the owner. So normal is really, in inverted commas, the same as pain, because it can be challenging, certainly. So this is the first case. So Liliana, I think that you were on. So I'm going to go through and just talk, and then at the end, Liliana, if you want to, add any bits and pieces, off we go. This is not about me doing an assessment of your dog and providing you as a physio consult, and providing you with a whole treatment plan. This is to show people, this is how we do it and what you can get for your own dogs. So first we have the signalment, which is the age, whether they're male or female, and the breed. So an 8-year-old female, we didn't collect the information whether they were desexed or not, so I haven't written that there. Female Siberian Husky. Now the female wasn't on there, but from the pictures, I thought she was female. So I apologize if I've made an error. So why does that make a difference? Already, right from that, 8-year-old female Siberian Husky, I am an experienced clinician, of course, but in my head, I'm going middle age going over into senior years. So I'm already seeing the dog in my head. Siberian Husky, so it's a large breed dog, furry, so I might not be able to see in anything. And I'm an experienced therapist, so I'm also going Siberian Husky. I'm just going to be a little bit more on guard, make sure most Huskies are fine, but also I've been nipped by quite a few Siberian Huskies. So already from the signalment, so if one of my team come and says, I've got this case I need help with, it's a dog that's got lumbosacral disease and it's in a lot of pain. First thing I'm going to say is tell me the signalment. So already we're teaching you to put the picture of the dog in your head. You're getting that together. So relevant history, and this is very brief, of course, so it's not going to be the whole part of what you would get. Owned since December 2016. So grade 1 luxating patella in the left hind limb. So now I'm going left hind limb problem, possibly. Previously been diagnosed with a benign melanoma in 2022 and recently diagnosed with a fibrosarcoma of the mouth in late 2024. So from a mobility point of view, massage, hydro point of view, I've got left hind limb issue in my head already. There may be no issue, and if we're in front of the client here, we would be asking them more questions. Do you see any limping, etc.? But this is just to show you that process. She also has a mysterious injury, so this is now our asterixy, something that's going on since early last year. So already now, early last year, that's a whole year. So if there's been a problem for a whole year, it's more chronic. If it was a muscular or a joint problem, then I'm expecting more muscle atrophy, maybe more lameness. Don't know. Originally, we thought it was gracilis, which is a muscle in the hind limb, if you're not familiar with that, but the orthopedic vet suspects not. X-rays show nothing of concern, which is good. So there's been some screening and there's nothing of concern. So we did 4 weeks of cryotherapy, so ice and cold laser therapy on moderate rest. So dog's been restricted. So again, now I'm going, okay, dog's been restricted. We might have some more muscle atrophy, could be all the way throughout. Issue has not been resolved. So we're following up with our vet again soon. So just on that tiny history, not extensive, then I can see the dog, it had and I don't know what leg this is. So maybe we'll just see if I can open my chat and just, Liliana, if you can. I thought I saw that you were on. If you're on, or you can come off mute and tell us.
Yeah, I'm here.
What leg is this problem on?
So almost both, to be honest with you. My initial thought was that perhaps she was overcompensating for the luxating patella in the left hind limb, which was causing the gracilis on the right hind limb to become tight. We're still unsure, but that's my thought anyway.
Sure. So is she limping on the right hind limb?
So no limping, but what I noticed, because when we do our dog sledding, I have a GoPro set up to film her as we're running, and her gait was just strange. Her right leg, the right hind limb sits pretty square underneath, but the left one kind of kicks out a little bit, and that's when I sort of noticed it.
Oh, okay. Thank you very much. So Now we have, so we've got that extra bit of information we're just going to use to show you this sort of piecing the information together. So we don't have to go and do diagnostics on the dog. We're using the history to tell us the dog's been to the vet, had different bits and pieces of assessment, had some rest, had some treatment, and the issue's still there. So from the limited part, we've been able to get, just for the purpose of this, that Liliana has shared with me. Then in my head, am I going mild, moderate, severe? Well, when we look at what she does, she previously, from September to December, did moderate activities, so quite active dog. So even though she's had the problem for a year, she's still been able to be an active dog. So I know there's a problem. We're not downplaying that, but I'm still going mild, not awful. As of January this year, she's more intensely crated. So she's only getting toilet trips outside now. And reason for assessment or bringing to the webinar, owner's first sled dog. She wasn't bred for the sport. She was from a backyard breeder. We started the sport 3 years ago and she's been loving it. Just a shame about her recent injury. So again, I would go into a much more extensive to and fro, but just for the purpose of the information that we have now, what I've changed to is now I'm seeing a dog with 2 hind limb problems, possibly left and a right. So we don't know, but we're just thinking about this in our heads. So then when we use, and we've got, limited pictures, so it's not the real dog in front of us, but we do a posture and a conformation assessment. So we stand the dog up, we would look from front and behind, and I've just put these pictures here. And we look for things like how wide are the feet apart? So are they too close, too narrow? Too close or too wide? You might not know. That's okay, but you're looking for things that stick out, of course. Teach you more stuff about conformation and posture. Certainly, we might also look at distance between front and hind limbs, spinal posture. So breeds are all different, but if we think of a dog that possibly both hind legs in one or the other, when hind legs are affected, dogs often transfer the weight forward. And if there's a spot here on the humerus, the greater tubercle of the humerus that we would palpate, if we drop a line from there down to the ground and acknowledging this is just a single point captured in time, so we would have the dog in front of us that would actually, be moving about, and we would have to see if it was consistent. But if this spot is falling in front of the paws, then the dog is transferring the weight forward. So then it could be unloading something in the hind limbs, potentially. When we look from the front, there's nothing super out of the ordinary. Feet are not turned out. I'm also not seeing like the hind paws. I can just see the 2 of them. We're not seeing one popped out to the side. So we're just looking for things that are obvious. It's not a really fine-tuned, is this or this or this. In terms of the spinal posture, this is relatively normal. So this dip down here is normal anatomy. There is a low little bony part, a spinous process on the vertebrae. So this is normal anatomy. It's a slight flexion of the spine is within normal. That's just an FYI for you. If someone thought that it was slightly more flexed, I would have to see her move around. In terms of, where is she holding her weight in the hind limbs? If her seat bone, her ischial tuberosity is going to be somewhere around here. If we dropped a line down to the ground at the back, it's still just falling, at the back of her hock, certainly within normal. And dogs, depending on their point in time, what they're trained to do, the hind limbs and where that line drops down at the back is not consistent between all the dogs. So it's more consistent on the front between all breeds that it should be, if it was right on the tip of the paw, I'd say it's more within normal. And then just for the purpose of this, I know we've just got this still point in time. Then when I'm looking at this caudal or posterior view of her sitting, then I can see there's a difference or a distance. Find my tongue in my mouth. The point of her hock is sitting here and her seat bone is over here. And here these 2 look closer together. So this is just from the still image. So that makes me think, and I've only got the left lateral. So looking at the left side here, this point of the hock is close to the ischial tuberosity. I'm pretty happy with the spinal posture. Like if we looked at that dog, we'd say, yeah, she looks pretty great. You know, she doesn't look like she's uncomfortable. She's sitting pretty square, but there's from the left lateral view from here, there's a distance between her point of her hock and her ischial tuberosity. And I would have to see, so her seat bone and her heel, and they should be able to be tucked in square. We would have to do multiple goes to see whether that was consistent. So we're not going to go through and talk about treatment yet. I'm going to do that later. We're just going to go on to the next case, which is Luca. So Luca is an 8-year-old male castrated. I know you said crossbreed, and you said, what do I think? And, you know, maybe there's, I just put, in Australia, we would call it a Staffy cross. Could be Pitbull, could be Amstaff, doesn't matter. It's that type of a look of dog, but a little smaller than that. So some other mixes in there, and relevant history that this dog has been owned by the current owner since September 2016 from a rescue shelter. It has hip dysplasia. So what are we thinking already when we're thinking about the dog that has hip dysplasia? Then I'm already thinking about if it was bilateral, both hind limbs affected. So what's that going to do? It's going to make the dog transfer its weight forward. It could sit in a different way, might be lame. So already just from those few bits and pieces of history, we're starting to get a picture in our head of what we think the dog might look like. So current exercise, walks or runs 1 hour daily, weekend twice per month. Walks over the river, visit to dog parks or country house, playing games with her sister and my 3 cats. So in my head, I'm like, this dog can do heaps of exercise. And I know we don't have all the details, but if it's that active and it had hip dysplasia, it's not very significant to me, or, you know, the dog's coping really well. So I know we don't have all the information, but we're just putting those pieces together and you're wanting to learn from it. Super. So when I put these pictures together, so remember they're just captured in time, and that's for this, when we don't get the camera view right from the side, then, you know, I've tried to make it a little bit skewy for you to be able to see. But the things that I'm seeing here are the spine, the lumbar spine, the low spine is a little bit flexed. The shoulder is a bit flexed, and I feel the weight is transferred forward. And that could be just the point that we've captured Luca in time. What I've also circled here, and this is easy for me to see as an experienced clinician, that this is a very skinny hamstring. So that is not a lot of muscle mass on the caudal thigh, on the posterior part of the thigh. And then when we have a look at the front here, the front legs look, you know, fairly symmetrical. One's not turned out. And this is a captured point in time, but we've got asymmetry of the hind limbs that we could see. So I know just captured in time, but the right leg has moved more towards the midline of the body, and the left leg is out to the side. So if the dog was here, we would have to see, you know, is that consistent? From the lateral view, we would look behind, all those things. But this is more just how we put these bits and pieces of information together, and then we would match it with the history and then with our superficial palpation afterwards. Oops, sorry, that should say Luca. I didn't change that. Sorry about that. And then when we look at the sitting, however, the lateral sitting, we've got a little bit of flexion within the lumbar spine or the spine, which can be normal. Ears up, dog looks happy, looks like sitting relatively squarely. Maybe the knees are pointing, stifles are pointing inward slightly. When we look from behind, again, could just be a point in time, but we've got a front leg that's pushed out to the side. So we might have some weight transferred in a certain way that the dog's having to offload that. I can also see, you know, a thickening on that elbow from this view. And we've got this gap between the point of the hock and the seat bone here on the left side. And I can't tell from the lateral side there. So that's why it's so important for us to make sure that we take all the history and we put all those bits and pieces together and work out, does that make sense? So if you just wrote in your history that the dog was not sitting square on the left hind limb, but the dog came to you with a right front limb lameness and elbow osteoarthritis, and there was nothing written about where it transferred its weight at the front, how much muscle atrophy there was in the front, then I'm going to be saying to you, what about the right front limb? That's what the owner brought the dog to you with. And this we were going to put as a so what factor. We're going to call it, well, it doesn't sit square, but the vet history hasn't said there's a problem. It's completely functional. Might ask the owner some other questions about, does your dog have problems with sit to stand, any other problems jumping up, etc., and try to work out, is that something of significance? But that's how we would piece everything together. And so we're not vets, yet you can perform a great assessment like this to decide on a treatment that's really going to help this dog. So it might need a non-steroidal anti-inflammatory if there was a lameness, for instance, but without doing the rest of this assessment and working out where the soft tissues could be affected, or looking for a functional something that we're going to address with our hydrotherapy. If we don't do that really great assessment, we can't then see the outcome as well. We can't explain to the owner, we really changed, what's going on for your dog, and they should see it in their assessment of their own dog. And then Sol, this is not Sol's picture, it's just while I talk about the GSP, German Short-Haired Pointer. So a 7-year-old male castrated, I think because we've just got male, so might not be castrated. I can't remember. Talia, I'll have to have a look. German Short-Haired Pointer, relevant history, none, so owned since 8 weeks of age, so owned since a puppy, so then the owner has the whole history. Large breed, short coat, means I should be able to see everything, on a short coat. Looking for ways to ensure he stays fit and healthy for as long as possible. His current exercise, running with the bike for about 40 minutes once or twice a week, off-leash bush walks on the other days, tracking detection and obedience training. So in my head, I'm going fit, healthy, no problems, when the owner's looking for ways to ensure he stays fit and healthy. So if they haven't reported anything, then when we go and look at the dog, I'm expecting weight should be transferred evenly between all the limbs. There should be no problems on gait. Functional assessment, sit to stand, should be normal. So we're using the information to guide what we're expecting to see, instead of just going in and trying to work out. Someone's drawing on my screen. I don't know how to get that off. So whoever is drawing on my screen, please stop doing that. Okay, so this is Sol in the position that he's in. So if we, this is a normal dog, and if we were doing that, where is he standing with his weight? So here's his greater tubercle of his humerus, and if we dropped a line down there, then it's just on the toe. His spine is nice and flat. So the normal, this is a little dip down here, is normal anatomy. So that looks quite normal, and his stance behind looks normal. When we look at him from the front, evenly distributed between left and right sides. So, we're just looking, does it all fit with the history? When we look at his sitting posture, so we're looking from behind, what's the distance between the point of his hock, or it's his heel bone, and his seat bone, his ischial tuberosity, and he looks like he's sitting square. So when we look at him from the side, again, nothing to see out of the ordinary to me. If you went into conditioning, so a lot of, so many different people offering great courses in canine fitness out and about there. Sometimes people have a preference to make dogs sit in a certain way that it's better for their performance. I'm pretty much all about function. So if the dog is completely functional and I don't find anything wrong with palpation, and he's sitting squarely, which he is, I'm not fussed about any of that. It's just my two bogs worth. So some people might comment that his back needs to be flatter with his sitting, and I think that he looks great. And Talia, you pop into the chat whether, I can't tell whether he's desexed or not. So also that could be a sit of a dog, a male dog that's not desexed. He looks like his bot's right down on the ground. So if they have testicles, sometimes they don't want to sit completely squarely. And sneaking away. He is castrated. Okay, right. Okay. So then really you've got that summary of the tiny bits of information we had and the little snapshots of these dogs. We don't have gait assessment. We didn't get to ask all the bits and pieces as we're going. Does he normally look like that? Does the dog normally do that? Can we do another sit to stand? Can I do one with a treat if they don't sit squarely when they're just hanging out in the consult room, and then I ask them to sit for a treat and they can sit squarely, but then they pop on over to the side? All of that information comes together to help us, get a picture of what's going on in our head. And I think the way that we teach that is really helpful for students and then graduates to be able to go out and feel confident that they can go and expect what they're going to find on the dog when they palpate it, do a treatment and make a difference for them. So we're going to then choose the treatments that are going to address what we found. And all the dogs are going to need body work and or massage. So body work, they might be including some treatment to the joints from a rehab or physio point of view, but body work, massage, every dog needs that, in my opinion, the same as every human. The longer they've been on the planet, then their fascial system, their myofascial system, their whole soft tissue system is going to have compensation, effect from exercise, just effects from day-to-day life, depending on the surface they live on, etc., any injuries or inflammation they have in their body, and they all benefit from it. And it's one of those transformative treatments to me that when we massage a dog, we can see such a great deal of difference in how they move. And for dogs that are sound like Soul, then keeping them in great check, throughout their life is really important. And many a client that has had a dog with a problem that we've treated, then when they have their next dogs or a young one, they come in and get the tips and go and look after their dog themselves throughout their life because they know the benefits. And hydrotherapy is really important for us from a strengthening point of view. So think of any mobility issue, neurological problems or limbs not working well, then we're using it as a re-education tool. So definitely superior to land-based exercise. You cannot swap it out. So dogs that are having land-based or home exercise programs and hydrotherapy will get the best outcome. If they could only have one or the other of those, I would choose hydrotherapy hands down 100% of the time. So for dogs with mobility issues, it is life-changing. For senior pets, we are lengthening their lives. Absolutely, so many dogs we get to see that transformation in. So they're quite different and yes, complementary. So when people ask which one should I choose, it probably really depends. If you're going to set up a business, obviously there's a lot bigger overheads from a hydro point of view. So yeah, this is just talking about the two different therapies, again, the massage and the hydrotherapy, wide-reaching benefits for the dog, but also the owner. So every owner that comes into our clinic, if we're massaging their dog, we teach them how to do that at home and continue on that therapy. And, yes, there's a lot of dogs, particularly with mobility issues from neurological conditions. If they didn't have the hydrotherapy, then they would not be with us. So now we're going to talk about treatment for Roxy, and then treatment for Luca, treatment for Soul, and we'll go and practice some of those. So if you've got your dog then. So I'll just talk about it briefly. So if we talked about, this is not a whole assessment, but just to give you the idea, if we had a weight transferred forward, and we'll make some stuff up. So weight transferred forward, say, bilateral limbs affected. So patella luxation on the left, and say there was a gracilis issue on the right, for instance. Now, I already know with the weight transferred forward with what we teach you, compensation, there's going to be compensation caudal, or that's posterior to the shoulder blades or the scapulae, because the dog's transferred the weight forward. I know there's going to be tension here, and we teach you whole protocols of where to look on the dog. So if I said to you, dog's got weight transferred forward, it's got left patella issue and a right gracilis problem, you should be able to tell me as a student and a graduate, I'm going to massage caudal to the scapula, I'm going to massage the lumbar-epaxials, I'm going to massage the left quads, and I'm going to massage the right gracilis as a baseline, regardless of what you found on palpation. Based on the history, taking the great assessment is going to then guide what you're going to do. So then if you've got a reactive dog that's like every time you touch it, so a Siberian Husky can be one of those, Roxy may not be, but every time I touch the Husky, then it's whee, jumps around and it jumps, and it's like, okay, I can't get a clear picture. Is the left sorer than the right? I can use that plan that I made, and I'm just going to treat those areas. And that's how, when you're a starting out massage therapist, then you work out, then I'm expecting to feel tightness in the gracilis and the quads because the history told me that. So I'm going to start treating those areas, and then I learn, that does actually feel different to the other one. So it's reverse engineered. Instead of you having to be the high level. I can't feel tension in the gracilis. It's like, doesn't matter. Treat it. And as you treat it and you start to get more familiar with tissues, then you will be able to feel it. And Luca here, for the purpose of this, we're going to say, well, there's, for instance, the hip dysplasia, we're going to say bilateral for the purpose of this. So, and some weight transferred forward, I'm going to say, okay, we caudal to the scapula because the weight's transferred forward, lumbar muscles, so low back muscles either side because the spine is a bit flexed, gluteals, quadriceps, hamstrings, based on the diagnosis. And we'll go through some of that with Claudia's dogs here. So there's lots of other areas that we could, treat as well. Maybe neck muscles of the weights transferred forward, but this is just as a base. And then a lovely sole. If there's nothing wrong with sole, then we're going to go for big muscle groups. So we're going to go for, what's his power muscles? His triceps, massive. So triceps, quads and hamstrings, and up and down either side of his spine, probably in his superficial pectorals and his muscles of propulsion as well. So I'm going to stop sharing my screen. So just give me a sec and we're going to see if we can get, how long have I gone? An hour already. So sorry, I do like to talk. I have a few more slides after this. Who's coming, Mickey or Kirby? So these are 2 clients of ours within the clinic. So I'm just going to be in this viewpoint so that you can try to see. Who do you want to use?
You can use Kirby, I can choose in the right position.
Right. So we're going to start with the muscles that are behind the scapula or the shoulder blades here. When dogs have their weight transferred forward, then they can get tension in these muscles and they can be uncomfortable for the dog. So we'll get her to sit. You want to sit, Kirby? Sit. So in the academy, we never force a dog to have any treatment. So you can practice along if you've got a dog there with these techniques. I can see my whole big view on my screen just so I can see it. So I can't see you guys very easily at the moment, but I can come back and help you out if you've got questions afterwards. But we don't force the dog to do anything. I'm in a safety position. So if you have your own dogs there, then even if it's your own dog, do not sit with your face in front of your dog's face. If they haven't had this type of treatment before, they're dogs. So if Mickey does something to Kirby, Kirby doesn't like, they, talk with their mouth. That's what they do. So I don't want you to get bitten. So I'm at the back of the dog. The dog's on the ground, not up on a table, which is the dogs are more relaxed. We've got a non-slip mat on the floor here. So the shoulder blades are sitting, coming up from the dog's front legs. The shoulder blades on the scapula are sitting here. When the dog has transferred the weight forward, then these muscles can get uncomfortable. So we're not going through and doing an assessment of the soft tissues, but for any of our dogs, most of them do a lot of pulling along with the front, and it's a great place to massage. So if we're using technique of hands that are in big contact with the dog. So if you've got a little wee dog, you might be using your fingertips, but have the rest of your hand in contact. So I might be massaging with my fingertips on the back of my hand, but the rest of my hand is in contact with the dog. So we're not pointing down on the dog what's uncomfortable. I'm going to use my fingertips in this region here, and we'll start everything superficially. So if I'm just really gentle pressure, almost like a pat, and I'm doing these little half overlapping circles. So I'm not thinking about treatment at the moment. It's, you can assess into this area and see. We would have done our superficial palpation, thank you, to see where she was sore. But now when we're going into treatment, most of your dogs will like this behind the front limbs. So this sitting position, lying down is also fine. So if I'm doing both sides at once, but if your dog is lying down and only one side is uppermost, then you might be one-handed, or if you can only use one hand, you use whatever you can use. So I'm in fingertips, I'm swapped to fingertips on this side, and I can feel Kirby has relaxed her body. She's just rolled her pelvis back a little bit more. She's doing kisses. Yeah. So I'm just keeping an eye on her body language. I'm going to go back to both my hands. She may lie down, in which case I will move around her. So we don't force the dog. The only thing would be if you had one that was a bit more lively, then I'm going to be hanging on to the collar. So I always leave a collar on the dog when I treat them. I would hang on to the collar with my elbow extended. So if the dog was going to turn around and try and bite me, I could push the dog away. So if you've got a little tiny wee dog, the principles are the same. You're going to go down? Good girl. Good girl. And so that will often happen rather in a consult room than forcing a dog to lie down initially. If your own dog will lie down, you can certainly do that. But rather than forcing them to lie down, start in the sitting position and they often end up down there on their own. So this would be, for this size dog, I might spend a good 5 minutes in around here. And there isn't a right or wrong with techniques. If you had sore fingers or thumb, you might choose to use the heel of your hand. Might use, can you please say open that little mini nano to find your flow? Oh, yeah. I also use a vibration. I know it's charged. Charged it last week. But a massage gun, so this one that I have a mini nano is quiet. So we have to check that the dogs are okay. Let's see if that's going to turn on. So a lot of people would have these. Yes. So we have to just check that the dogs, so this will be normal. Dog wants to move around in the console. Have to just check. We might use you then, Mickey. Mickey, come. Yeah, yeah. Say a little bit more. So I will just show the dog, just so that they can have a sniff of it if they need to. If she's a bit worried about it. Put the end on her. All right, will you sit? Make you sit. Sit. Yeah. But we can also use a massage gun if the dog is happy with it. So that can be a way that you can, in those same areas, no contraindications to using it anywhere apart from the carotid artery in the neck, but I can't see why you would be going to the carotid artery in the neck anyway. So that's just as a variation. I'm going to keep it standing. For the thighs, I'm going to move back to the thighs. So if the dog is sitting, I'm not going to be able to get to the front and the back of the thigh. So standing, or the dog's going to be lying flat on its side. Thank you. So most of this is a trick if you put the tail under your arm there. So wedge your tail in under your arm so it's not blowing in my face. She's self-serving in the treats over there. If we try and force the dog to lie down, they're going to be nervous about that. So the standing position can be a common position we have to manage a hind limb in. And then again, as we work through our massage and the dog, if the dog chose to lie down, then we could massage there. So when we've got a big muscle, so the same as triceps, which we'll do like we were going to do for Sol in a minute, but for Roxy and Luca, we would be doing anterior or cranial thigh, it's called. You're going to pick up the muscle between fingers and thumb, you know, and do a knead. So we're going to think about like kneading dogs. So this is for any sound dog, but also dogs with hind limb problems. This would be a common position that I would be getting the owner to massage in. And if the dog's sitting, the leg is all bent up, so it's hard for you to get into the thigh. So that's why we need that. If the dog was having trouble standing, then my other arm, my right arm, is going to be underneath the belly to hold the dog up. And we can also use different techniques. I can put my knee up between her leg at the back here to hold her up. Kirby wants to go. So then I can swap around to the caudal part, and I've got my knee up between her leg at the back to help hold her in standing. So we're trying, you know, unload our body so I don't have to hold, you know, with my neck, hold the dog up. I can use this part of my body. If she was a little wee dog, I'll just finish massaging her hamstring here. So I'm doing same technique on the hamstring and the gracilis. Many of you might not know your anatomy. Many of you might know your anatomy. The gracilis is actually, you know, on the inside of the thigh. So if it was Roxy's right gracilis, then I'm going to move on to the other thigh, the right thigh, but I'm just on the inside. And if it was the left side here, it looks like me massaging the hamstrings, but I'm placing more emphasis on my thumb on the inside. So I've just chosen to massage the groups that my history told me. I didn't have to go, I'm not sure, is that tense? I don't know. You don't have to know initially. We use the history, all of those parts of the history to say, well, she's got a patella luxation on the left side. So I'm going to massage the quads because we would teach you that. They work really hard to hold on to the patella. I'm definitely going to massage the gracilis on the right side. And the lumbar spine, if the dogs are transferring weight forward, then the muscles on either side of the spine can get some discomfort. So she's telling me, yes, I have a little bit of that as well. So I don't want you to massage your dog's back in standing. So we'll get her to sit.
Mickey, sit. Sit.
Good girl.
Come on.
Come on, Mick.
Mickey, sit.
Come on,
Mickey,
love.
sit.
Good girl. Good girl. And so we have a little bed in here, but when we have this size dog, we have a big expanse of mats in the room because this is often what happens. I chase the dog around the consult room because I want to try and keep her, happy. So there is an element of that. If she says, no, I'm going to get up, we'll be like, no, let's stay here. But if she kept trying to move away, then I would move around. So when we're getting the muscles on the lower back, let's see. Run around a bit, yeah, even just sit, sit your butt, sit,
Mickey,
sit my darling,
sit.
sit Mickey, sit, good girl. And also because of this demonstration, I've started the massage. She might be a little bit more out of sorts as well. So the muscles are sitting in two big strips either side of the spine. So for all your dogs, you're always massaging anything in comfort. So large hand position. There's half overlapping circles. So just start superficially. Then got an itchy spot. We work into what she allows. So just going further up her spine, I'm going to stop because I'm getting to, some dogs have that itchy spot, making her scratch. So I'm just going to keep into this lower part here. Now we can massage down. There's no right or wrong. Mechanically for my body, easier for me to massage up. If the dog didn't like that because of their coat, then I'll have to adapt. So I'll massage down. Then if she was lying on her side, then, and so I've only got this left side uppermost, then I'm going to swap, do these half overlapping techniques. Now I can feel tension in these muscles. When you start out, you don't need to be able to work out what the tension is. The history and all those parts together. So the history, that includes the bits that we saw when we walked her and did her functional assessments and her superficial palpation. That tells us what we're going to treat. So we start treating those. And then we get better at, so now that I'm treating her, now I can feel this tight band on the left side, not on the right. And as I'm massaging, then now I'm thinking to myself, is there a reason for that? Do I go back into the history? Is there a reason? Did she not sit square on that side? Did she compensate this way? So your brain's continuing to try to analyze while you're assessing and treating. And it is a continual process. Assess and treat. In the hydrotherapy, many of these dogs, so certainly Luca and Roxy, hydrotherapy, if they're in our clinic, would be something that was recommended from a muscle growth point of view, allowing the dogs to use their limbs to a normal range of motion instead of a little shortened step or a compensation. So it allows then a more normal extents of the muscle. And we continue to assess and treat. We watch them in the hydro and see is their gait pattern changing, and we might need to tweak it as we're going. So always doing the same thing. And if we were doing neck, we could be able to say neck. Yes, if we were doing the neck, we can, as long as the dog doesn't have a contraindication to massage in the neck, like a wobbler or something like that, for you guys, then we don't have to lie the dog down for neck. I'll try and hang on under the dog's jaw if they're comfortable with that. It just depends on the dog. And like we did in the low back, then we're doing this same thing. We're doing the kisses. Kisses. This is nice, isn't it? So most people's dogs would love that in the neck. And I've just got big fingers open, lots of hand contact. So again, whether we're on the thighs, whether we're on the low back, whether we're on the triceps, lots of hand contact half overlapping circles, and I'm going in with what she tolerates. So my speed looks quite fast. I'm very experienced at massaging, so I might have, in a dog I didn't know, started much slower. And as I thought they were okay with that, then I can increase my speed. In this position, then I can also do the triceps. Just a little bit here. So her triceps are sitting up above her elbow. So this is where, if you're a student, you need to know your anatomy, because I'll be saying to you, where's her triceps? So we teach you how to work out where the anatomy is from all the bony structures. So then I can say, well, this is her tricep. I'm going to get in with that technique. Stand up on a sec as well. And big knee to the triceps. So I could treat both sides if I'm going left and right at the same time. I will tend to just treat one side of the body except for the spine if the dog was in this position. And so wherever we've got these big groups of muscle, we can do that in the like in Sol, who's an active dog as well. We can do it in the muscles on the front of the armpit as well. What do you reckon? Good. Let's see if she'll come around this way. Just a little whisker. Oh, next. She's going to be right. Oh no, that's pretty good. Right in front of the camera. Perfect. So I'm going into the muscles that are right up into her armpit, and I'm doing this same squeezing. Yeah. And if she was lying on her side, we could do it in that position. If she was sitting, trying to sit, Mickey, sit, sit. Good girl, good girl. We can do it in this position. Right, and hold up this leg. Get into here as well, as long as she can balance. Okay. So for most dogs, thank you, girls. I'll just come back up to the screen, swap my camera. For most dogs, it would be most of the pathologies we see in here would be common to do muscles behind the scapulae or the shoulder blades, neck, low back muscles, and then the leg muscles we'll choose based on the history. So just going into the back end here. So I'll just go and share a couple more slides, and then I'll open up for some questions. So we're remembering, after all that, we're not making the diagnosis. That's the vet's job, but we need to work together as a team with them. And we're aiming to make the dog move and feel well, maximize its mobility and longevity. So it's not just enough, like in human healthcare now, we're making people live long period of time, but not very functional or able-bodied. So it's the same with our dogs. We don't want to just give them medication so they live longer. We want a life of vitality and happiness. That's really important to me. So, oops, let me just stop sharing that. And I'll just go in and check some questions we have, if there's.
Haven't really got any questions at this stage. Everyone's been watching and learning, I think.
Super. So if you've got any questions while I just keep chatting here for a bit, if you've got any questions, then certainly ask away. For the people whose dogs we put here, I know I haven't done a big overall assessment, but it's more to show you, that you can take the history of your own dog and then stand it up and look to see where you think there could be issues that you can treat. And if you're coming through, as a student into our program, then we teach it in a way that makes much more sense than you trying to work out, where all the different bits and pieces are and is this tight or not, and also how we can do it virtually. So that's the other part for you to reinforce. So it's really thinking about now, if you've got questions about anything that I shared, please, of course, add them into the chat. And then, I'd really like to just move into, that we're open for our certificate programs, that the next intake starts in March. And I'd really like you to feel into what I feel, the passion that I have, and work out if there's something that you're in alignment with, if it's something for you. If it's not, completely okay. you get to see what it's like if we work in a clinic like this on a day-to-day basis, or if you were able to do that in your own business. And we get to see the transformation that we make in dogs and humans' lives on a day-to-day basis, both within the clinic and what our graduates have been able to achieve, and the successful businesses that they have is really amazing. And for my life's work and my passion to be able to help dogs live longer, happier, healthier lives, I'd really love if you feel the calling to join us to do that, to be able to share that with you. We do have another webinar that is recorded that we can send you the details of, or the recording of, that I've offered in the past, which is just really all the different bits and pieces about the course. So all the different modules and really more about, the course itself. But I wanted to share this with you about how I teach, how you can do an assessment of your own dog and make a difference to the lives of the dogs that are in your life. And if I just pop that back in and share this, just so that we've got the links here. The team or Tegan are going to send them over to you. If you've got any links, if you've got any questions and you want to connect with us, we'd love to have a call with you. You might be interested in, is it for you? Is it a good fit? We've got payment plans to suit everyone. So you can either communicate with us straight via email at info@caninehealthacademy.com. You can book a call to talk to one of our team, and we'll send you the links for those as well. And if you're already knew that you were ready to purchase, but you just wanted to meet me and see what I'm like with my teaching style, we'll send you all the links to join as well. So I wanted to thank you for the people that are joined us live. And if you're watching on the recording and you have any questions, then please send them through to us. I'm just going to open up my chat here. And I'll go through some of the questions that I can see. Alyssa, do you consider toenail length and health when assessing gait? Seen dogs with long toenails? Yeah, absolutely. So it makes a big deal of difference. You're quite right. That would come into the whole assessment. That in our looking part, we're going to look at the feet, certainly. And thank you for your feedback. It's nice for me to be able to connect with you, and for some people that have come in at the end, yes, you can watch the recording, and I really hope that you learn something that you can help your own doggy and any of the doggies that are in your care, be they clients, patients, or families' dogs, to make them move and feel better. Alyssa's asked, do I consider diet in your initial assessment? Yeah, so what I do in my initial assessment as an animal physiotherapist is different to massage therapists and hydrotherapists from a dietary point of view. So you have to stay inside scope of practice. So you have to only talk about that which you're qualified. So we will all have, if we start to open up a conversation about diet, then that could be 3-day training in and of itself. So we're careful to, my team are trained here, we're careful to keep our own opinions to ourselves about what a client may or may not be doing unless we're qualified. So we have a vet in our clinic, so she can give nutrition advice. Because we're an integrative health care clinic here, then we do promote nutrient-dense natural food. And I agree with you. It is our belief of, inflammatory inflammation is increased by processed foods. We know that it is. So it's not just my belief. We know that it is. So if we're seeing dogs with chronic arthritis and inflammatory conditions, then changing them onto a natural diet, there's good evidence that makes a difference. But we're careful about what we're putting into our consult. If I'm operating as a massage therapist, I'm doing massage. So we do have a question on our form. And if you're in the academy, there's a question about diet. But what we do with that information just depends on your level of experience and the vet that, you're not wanting to offend the vet that sends you a patient as well. So there's a whole bunch of factors in there, but we do that. Show us how to do a cruciate massage. Yeah, Catherine. So in doing a cruciate massage, then who is that? I've got it. That's it. We've got to go back to the dogs. Sorry, my darling. Stand up here. So cruciate massage is the same as any hind limb problem where the quads will be affected. So the knee joint is here where the cruciate is. The muscles that most commonly affected is going to be on the front of the thigh. So the uppermost part of the thigh. So we've got fingers on the inside of the groin and thumb on the outside, and we're doing a knead of these muscles. So the dog could either be in standing, supported, because then the leg's hanging away from the body, or the dog could be lying flat on the side. So this would be the most common place on the affected side. Sometimes they're sore in the low back as well. Will you sit, my darling? Sit, Nikki. Sit. Just as a demonstration of if they're sitting, trying to get into the quads in here. She's just popped her leg out. Nice. In a very cooperative way for me, but a lot of dogs, they're holding the leg up flexed, so we can't, if it's flexed up in here, I can't get in and massage here, but she's extended her leg out beautifully for me. So if the dog extended the leg away, I can get in. It's basically just as long as we can get into that area, that's where they get most sore from a cruciate point of view. There are other points, so calf muscle, gastrocnemius, hamstring. There's other areas, but if you had a patient, a case within, and you're a student in the academy and had a cruciate issue, and I said, where's the first muscle you're going to massage? Then you should be answering the quads, but we would teach you that. So just make sure I answer that question. We'll leave you there in case.
Michelle, there was a question about how much pressure do you use?
Yeah.
Because especially considering Kirby's got so much hair, thick hair.
So the pressure that you use is determined by what the dog allows you to do. So when I mentioned that we start gently and increase as the dog allows. So if we, for all dogs here, even these two dogs here, the pressure that I use is going to be different between the two dogs. So thinking about pressure that's going to make a difference to the tissues, we want to be able to get in and remove some stickiness between the fibers. But if the dog doesn't like palpation, doesn't really like deep pressure, then I can't use deep pressure. And at the other extreme, if we had a really stoic dog that let me do whatever, then common sense of, if you think of how hard you're pushing on your upper trapezius muscle here, there gets to a point where that's very uncomfortable. So common sense. So we can't then say about, whatever 5 kilos of pressure or 5 pounds of pressure, because it's going to very much differ. So we always start superficially and we work down, aiming to, here's all the list of things we do superficially, and here's the list of techniques we use deeply and in these muscle groups. So on a flat muscle group, posterior or caudal to the scapula or the shoulder blades, the muscle is very thin there. So I'm never thinking I'm going to go super deep there. On these guys, very large muscles, for me to get through that depth of tissue, I'm going to massage for a longer period of time. I may be able to go deeper, or she may be very uncomfortable. So how am I going to know? I use the history. She was very, very lame. I'm expecting she's going to be, if she was, more tender. So I'm going to go more gently. So those things come together, the history, meaning what the dog had as a pathology, how they presented, and then the coat, the dog's tolerance. So, we're increasing our pressure always with it as the dog tolerates, and aiming to never force them to have anything that they didn't like. But if these guys have a lot of body work, so they're very experienced with it. But still, when I was massaging Kirby's back before, she liked a bit, and then she turned her head around and went, hey, that's a little bit deep. So then I back my pressure off, and that's, me that massages her. We still just have these, like if someone's massaging my shoulders, the same thing. I'm going to go, yeah, that's good. And then like, that's not so good. So the dog gives us the feedback. And the same with how can you tell if a muscle is tight, Sarah, that we've used, this is the best way when you're starting. You've used the history to tell you what muscles we think are going to be affected. So that means what the pathology they had, how they looked, so how they stood, how they moved, how they sat, which, we give you protocols and patterns of what muscles are going to be affected based on that. And then you go and massage those. So you assess them, and then you say, oh, I can't tell if this is tight or not. So it's a good question. If we've got a muscle-bound dog or a muscle-bound human, for instance, someone that works out a lot and has got very taut muscles because they're hypertrophied, how do we know what is muscle tightness versus just they got big developed muscles? We have to use the history. So the same for Sol, the GSP we could say the same. if we didn't know that he had any problems, because he's completely functional, we're going to try and massage his whole body. And then as we become more experienced, or as we're massaging, we're thinking, then if the tissue feels different, and there are particular ways we teach you to do that, some of it is on yourself, some of it is on other humans, some of it's on dogs. But the best is if you have a dog that has a problem, so it's got a stifle issue, there's going to be tension in the cranial thigh. So I'll teach you that pattern. You go looking for that. And that's how you work out what tension is, because it's going to be there, because I tell you it's going to be there, because I know it's going to be there by the presentation of the dog. So it is this reverse engineering. This is my technique, the Canine Health and Wellbeing Academy way. Stop getting into, not you, but don't get into your head about, I can't tell, is that tender? Or I can't tell, is that atrophied? The history guides what you're going to find, and then your learning happens, in reverse, because we have a dog with hip dysplasia, they're going to have atrophy to the gluteals. They're just going to, they have to. So you go looking for what atrophy of the gluteals feels like. We have a dog with stifle disease. It has to have atrophy to the quads its whole life. The leg will never be the same as the other side. Never, 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 never. So you have to be able to feel, doesn't matter how much rehab you do, you will be able to feel atrophy, and you will learn what that is. Instead of trying to work it out where it is, you use the history to guide you. So hopefully that helps you with those. What do I find most stressful about this work? The most stressful thing, Sarah, would be, when we have a dog at the top end of its life, and we've done all the things that we can do, and, they still have to transition over. That is the most stressful part. So we have an amazing team of people that are so passionate, because, it starts from the top down. Of course, we all feel the same way. The most stressful thing in our job is when we either can't fit a dog in that we need to into the schedule, because everybody here is desperate to help, or when a dog, finally passes away. So there is a care burden, but for the most part, not the same as in veterinary medicine, because people are coming here because, they care and they're doing whatever they can for their animals. So that would be the most stressful part. The day goes, it just goes. So there's no one here going, how long until I go on break? It's not boring, and the day just goes. So hopefully, it's been able to answer some questions, or get you to meet me, for us to have a connection, for you to see inside how we work. If you have any other questions, then please reach out to the team. They're amazing support. And, I haven't seen any other questions. I'll just hang around for a couple of minutes. If you've got anything that you want to share, or that you want to ask, we're always happy to help you. Same if you're on the replay, but thank you very much for your time. And hopefully we get to meet some of you further on down the track